We talked to a lot of donors that were interested in contributing to the emergency room. And it didn't take very long for us to realize that most of those people were connected to the organization through Joe Corkery. So a group of us said, why aren't we naming this after Joe?
Joe is the consummate primary care doctor, incredibly patient. He's a great listener and a brilliant diagnostician.
He is the kind of doctor, the type of doctor, his door is always open, whether it's personal or professional. No is not an option for him ever.
I admire him a lot because you always feel like when you're with him, you're the only one that he is there for. You leave his office always feeling like you feel better now. I talked to Dr. Corkery, I feel better now.
Probably the biggest trait that is particular to Joe is his search for excellence. He's always striving to be better at what he does.
I grew up in a medical family, and I knew very early that I wanted to be a doctor. I did have some ambivalence at one point because I wanted to be a cowboy. I thought for many years I would be a cowboy doctor, but I grew out of the cowboy part. Back then, the office was in the home. It was a 24/7 commitment, and I didn't know any better. I sort of assumed that's part of the calling of being a doctor. Coming into medicine with that expectation about the importance of respect for the patients, the importance of your availability, it's never been work for me. It's always been fun.
Despite the fact that he's a doctor's doctor, you'd never know it by his demeanor. You know, he's not a guy with a big ego. There isn't anybody here from the housekeeping staff to the CEO who doesn't feel like they have a warm and personal relationship with Joe. Joe has always had a special place in his heart for women and their careers at Leahy. Always went out of his way to figure out how he could help you take that next step. I don't think I would be where I am without Joe.
As the Leahy health system has evolved, we are taking care of sicker and sicker patients on a routine basis. More and more patients are being transported to the Leahy Hospital emergency room from outlying hospitals and physician groups, and the new facility will enable us to provide the most spectacular care.
Well, we were originally built to see about 17,000 patients a year, and we outgrew that, I think, on the second year it was open. It was never a space that was really meant to be an emergency department.
It's very cramped, really small space, not a lot of privacy, not a lot of room for delivering the kind of care that we really want to be able to deliver here.
We evolved, we added space here and there, but it never really had the right space for the patients or the staff. We think that the capacity of the new emergency department will be, in the end, about 65,000 visits a year if we used every space every minute of the day.
We've always delivered high-quality care in the emergency room, and this patient-centric focus actually epitomizes what Joe Corkery is in his relationship with his patients.
I think he represents what Leahy's all about, and we want that to transcend to the emergency department. So it's been a long road, but I really think we're going to end up in the right space, and it's been well worth the wait.
At the beginning of this adventure, Joe and I often would sit and try to figure out where we were going to find the money to pay for the building. And on many occasions I said to Joe, get ready to dig, because we were going to do this come hell or high water.
We knew that philanthropy would have to play a major role in helping us achieve our goals. And so we are just so grateful for the many, many people, and many of Joe's patients in particular, who stepped forward to say, how can I help?
And what amazed me was immediately upon hearing the possibility that Joe would be honored, they uniformly responded, count me in.
So we are just proud and happy that we're able to have Dr. Corkery's name on a building and on an institution that he has served so well over these last 30+ years.
For our donors, it is clear to me that this would not have happened without you. As we sit here today, over 60% of the cost of the new emergency department has been provided by you And it's so gratifying for me that there will be generations of Leahy patients who will receive the best possible care in the new Joseph C. Corkery Emergency Center. Joe, you represent the best of Leahy, and it's so absolutely fitting that you be honored in this fashion. I want generations of patients and physicians to all ask the question, what about Joe Corkery?
He's had a real impact on the care of individuals, but also the health of the much larger Leahy community.
Joe's one of the smartest people I've ever worked with.
Just a great doctor.
He's really the quintessential Leahy physician.
It's a wonderful tribute to him, and it's a wonderful honor for our family.